Every day, 7 days a week, 365 days of the year for the next 20 years, we boomers will be turning 65 at the rate of between 8,000 and 10,000 per day. That's every day, 7 days a week, 365 days of the year. That's that silver tsunami. That's the pig and the python marching out.
The explosion in the number of elderly has profound implications for private sector business, as well as local, state, and federal policies. And much of the goal of today's conference is to work at that intersection between business policy and what the academic community can bring to bear.
I'll summarize my talk, I think, in 3 points about the impact of the aging population on healthcare and how I'm thinking about it as a public official, and particularly someone who's overseeing the Medicaid program. I think the first point is I'm worried. Second point is we're doing some stuff. And the third is we got to do a lot more.
Economics is about choice. And so I think that the major policy is not to talk about the Affordable Care Act or this act, but we need to choose life. We need to make life and the quality of life a priority in our nation and in our world.
But I think one of the reasons why our outcomes aren't better is because supportive care services, we're not investing there. And great if you can have the patient in the hospital or give them a pill or something, but if their community situation isn't leading to a healthy lifestyle, then forget it. That investment is poorly made.
But then when you look at the statistics of the number of people who are 60 years old and have less than $50,000 saved, if you start thinking about moving those people forward, and if they're going to live another 25 years, you're going to have a huge percentage of the population that's going to be in a pretty difficult financial situation.
First of all, I think we need to be honest about age discrimination in the workplace, that it is hard to get a job, especially if you're 60 and you've been laid off. There aren't a lot of people that want to hire you. They just see giant risk factors.
Those are challenges, but I also think inherent in those challenges are huge opportunities, and I think we need to reposition aging as a major engine for economic growth, for innovation, business development, employment growth.
I think the real question is, how do we use common sense to build collaborative models where 2 or 3 people who are involved in delivering care can share a common goal that will benefit everybody?
We're really stuck at the federal level. However, there's an awful lot of interesting experimentation going on in the states out there.
But I also think that all of the answers, and they never were, all the answers are not going to come from government. They never have, they never will. And so this is a team effort.
Until we really decide that we as a population, a community, have responsibility for each other, then these big things that we're here talking about are only going to get worse. That's what the issue is.
I do think the Business of Healthcare Conference is bringing together a lot of the pieces that have to be in place to bring about change and to really make some impact.
For us to be successful in what we do, we need not just talented physicians and nurses, but lots of people who understand how the general economy works and how it works in particular as it relates to healthcare. And that's where people like the Kenan Institute have such talent and such expertise that we can draw on.
So, I really think if you're looking for interaction with whether it's practitioners, whether it's policymakers, whether it's academics, then coming to the next Business of Healthcare Conference offers an opportunity that really doesn't exist anywhere else.